Hi everyone, good morning. Thank you very much for joining me for this Exercise Right Week special edition pelvic floor webinar. My name is Esme Soan. I'm an accredited exercise physiologist here at Pair Exercise Physiology with special interest in women's health. When I'm not working as a clinician, I also teach other allied health professionals about all aspects of women's health with the Women's Health Collective. So I'm really excited to bring to you this morning a little bit of a discussion and chat all about our pelvic floor, where it is, what exactly it does, and how we can best exercise that muscle group. So I'm just going to share my screen with you so that I can show you PowerPoint. All right, so there I am at work. So Pair is the name of the practice that I'm currently at. It's Wednesday morning. We've got some lovely exercise classes going on outside, restricted in size for coronavirus. But there's some of my contact details if you did have any other questions at the end of this webinar. As I said, when I'm not working at Pair as a clinician, I teach with the Women's Health Collective. I can see that we do have a few health practitioners on this morning's webinar. Hello to you all. Happy Exercise Right Week. So I want to cover the pelvic floor anatomy. So it really helps for us to fully understand where our pelvic floor muscles are to then better be able to activate them. They can be a little bit of a mystery muscle group because we can't see them and we don't always know that we are correctly activating them. So here we can see in the diagram exactly where those pelvic floor muscles are located. So at the base of the pelvis, they provide almost like a bit of a trampoline sling support to our pelvic organs. So as well as on the screen here, I'll just stop here, you can see in my model I have here in the studio, here's our pelvis. So our pelvis would sit right here. We can feel these bony portions on the very front of ourselves. If you ever feel around, you can find those bony protrusions, our ASIS. So if we look down then into the pelvis, we can see here in my model, I've got my uterus covered in blue, fallopian tubes and ovaries. At the back here would be where our rectum would sit. At the front is where our bladder would sit. In my model here, she's missing both a bladder and a bowel, but you can see that she does have her ovaries and her uterus here in the middle. So you can look down in and see all of the red material that makes up that pelvic floor. If we switch now and look from the base of our pelvic floor, so you can see here you've got your anus and vulva. And again, everything that's covered in red across this model is part of our pelvic floor. So our pelvic floor is not one flat muscle group, it's actually a group of 4 muscles that are working together. And it also is all of the fascial connections and ligamentous structures that support around the pelvic bowl. So our pelvic floor is actually a group of muscles and tissues that work together, not just one flat muscle group. So if we go back in to our presentation, you can see here, so this is that side view. So if we split myself straight down the middle, you can then look into the pelvic bowl and you can see our bladder, our uterus, our bowel, and the insertion points for pelvic floor. So inserts onto pubic bone at the front, coccyx or tailbone at the back. So as I said, our pelvic floor is not just one flat muscle, it's actually a group of 4 muscle groups that work together. And often we'll describe it like a hammock, but it's more like the base of a wicker basket, our pelvic floor muscle groups that kind of are woven together. So it's a complex web of muscle, fascia. So fascia in our bodies is kind of like if you're preparing raw chicken, it's that kind of synovial, that white tissue that we discard. That's what fascia actually is like in our body. It also works as a diaphragm. So we've often heard of our respiratory diaphragm. We know that this is a diaphragm. We have multiple diaphragms throughout our body, and our pelvic floor acts like a diaphragm as well, because it plays a role in helping with maintaining pressures through our abdomen. We have a pressure system that sits in our thorax. We can consider our popliteal, so our muscle that is behind the knees, like a diaphragm, because it helps again with pressures and pushing of fluid up from our lower limbs. So it acts like a diaphragm as well. Our pelvic floor muscle groups have 3 main roles. One is to support the weight of those pelvic organs, and you can see how during pregnancy that job would get a little bit harder in supporting that weight. It plays a role in maintaining continence and a role in sexual function, and it also helps resist downward forces from our abdomen. So every time we cough, laugh, sneeze, jump, and the weight of those pelvic organs or the pressure from our diaphragm pushing down, our pelvic floor is acting to help support and resist those downward forces. So here is another view of our pelvic floor. As you can see, that's in my model. If I just turn it upside down, here now we have the spine and the tailbone at the back of our model, pubic bone and pubic symphysis joint at the front. We're going to identify the 4 muscle groups that make up the pelvic floor. So at the top, you can see puborectalis, pubococcygeus, and iliococcygeus. The names give away their origin and insertion points. So all the health profs who are on this call, puborectalis is an interesting one. As part of this muscle group, we'll talk about it a little bit more as we go through the slides. But you can see that they have that pubic bone origin site, coccygeus, coccyx, attaching then onto the tailbone. So those 3 muscle groups together make up what's called the levator ani group. So 3 muscles that are then linked into one. We also have coccygeus, which is identified on this diagram with a blue arrow. And coccygeus is the last group muscle that makes up our pelvic floor muscle groups. It's also really interesting to have a look at how pelvic floor shares some attachment sites around the outside of the pelvic bowl. So you can see some shared fascial connections with the obturator group. And obturator muscles control our kind of external and internal rotations. If you think of like a ballerina in turnout, that part of that muscle group is responsible for that movement. All right, so the levator ani group. Levator ani literally just means to lift the anus. So that gives you an indication of its role and of its job. So it really helps to support the pelvic organs and removes the strain on the endopelvic fascia, so that tissue I was talking about earlier, that is woven around all of the organs and that the muscles within the pelvic bowl. So it's those 3 muscle groups together. And as I said, their names give away their origin and insertions. Puborectalis is an interesting one as it does not have an insertion point. It actually wraps around the rectum, and we call it the squatty potty muscle. So in this diagram here, we really strongly recommend looking after your pelvic floor, in particular through pregnancy and early postpartum, or if you have any pelvic floor dysfunction like hypertonicity in pelvic floor from chronic pelvic pain or pelvic organ prolapse. So looking at using something like a Scotty potty, and this is where we work in really closely with fantastic practitioners like women's health physiotherapists who really help by providing that internal exam, that localized muscle group rehab of the pelvic floor, and they can help to provide some long-term education on pelvic floor health, pass on all the information. They make up a little pelvic floor report card for us as exercise physiologists, so we know exactly where we're starting with pelvic floor rehab and how we can correctly progress that pelvic floor rehab to get you back to the running or the jumping or the CrossFit style movement, always that's appropriate to that level of pelvic floor rehab that you're at. So we can see here that puborectalis is indicated in the sitting and squatting diagrams by that loop, that colored loop. So you can see that when we're sitting, we still have a little bit of tension within that puborectalis muscle group. When we come into a squat position or we bring the knees higher up and changing that hip angle, we actually help to relax off that portion of the pelvic floor muscle group. And so it helps to resist placing too much of that intra-abdominal pressure, that downward forcing. If we make a noise and we create that valsalva, that pushing and bearing down, we can place a bit too much stress on pelvic floor. So our squatty potty muscle group as part of the pelvic floor. Our last muscle group that's part of our pelvic floor is coccygeus. So coccygeus would control the tail if we had one. It does not play a role in elevating the anus. So our pelvic floor does not work alone. It's part of our core. So often in fitness language, we can really get mixed up in what our core truly is. So our core is not just our abs. Our core is literally, if we were to core an apple or a pear, if we were to core that pear, it is the core set of muscle groups that help support us from the very inside. So our core is made up of our diaphragm at the top, our pelvic floor at the bottom, our deep lower back muscles, multifidus along our spine, and our deep abdominal wall muscles, we call them our transverse abdominis, or a TA. So these four muscle groups need to work in synergy to be able to have good core strategy. So they need to all be working together to help with maintaining our core strength. If we have one muscle group that's not working optimally, so say we have abdominal separation after pregnancies, or we have some if we have some pelvic floor dysfunction, lower back pain, so we can often see that then more stress is then placed on the other muscles that make up part of the core. We want to be mindful of making sure that we train pelvic floor to work in with this core synergy as part of our pelvic floor training. This core synergy is also really challenged in pregnancy. So as you could expect, as we start to grow more of our bump, our abdominal wall is changed in how it can function, because of course we have a little bit of movement of our abdominal muscles. Everything very normal, very common, expected in pregnancy. They have to go somewhere to accommodate that bump. We want to make sure that we still continue training pelvic floor to be able to cope with those changes through pregnancy. What we want to avoid when we're training for our pelvic floor is too much breath holding or an incorrect strategy for turning on our deep abdominal wall. So we want to think of just taking gentle breaths and working pelvic floor in with our breathing. We don't want to breath hold. You can see there in the diagram, as we breath hold, we bear down slightly through the diaphragm, and we don't want to think of hollowing or scooping through the abdominal wall either. So often in Pilates classes, you might hear instructors say things like belly button to spine. That's not always appropriate, because we don't want to think of hollowing or doming through our tummy. We want to think of using all those core muscles together. So it's more of a gentle, almost a sliding over one another of that abdominal wall, rather than hollowing away or bearing out forward. This can be where things can get a little bit confusing in how to correctly perform these exercises. And this is where we can certainly help as exercise physiologists and women's health physiotherapists. We can all work in together to help correctly identify your own best pelvic floor cues. Pelvic floor is very much to do with how we have motor control of that muscle group. And as we go through some of our pelvic floor exercises at the end of today's presentation, I'll talk you through some of the common cues that we use to help with getting that pelvic floor activation. So that's another great thing of working with both a women's health physio and an exercise physiologist together, is that part of that women's health physiotherapy internal examination screen, they'll actually identify which cue works best for you. So we have a wonderful women's health physio who works with us here at Pear, and she, yes, like I said, will let us know exactly where you're at in your pelvic floor activation, and then how to best cue you. So what words make most sense to your brain and your pelvic floor activation. So when we're looking at pelvic floor exercises, we do want to identify both from a local point of view, so looking at the pelvic floor just itself in isolation, but we also want to consider a global point of view. How are we going through that pelvic stability? What kind of glute activation do we have? What kind of core muscle activation do we have? What's our breathing strategy? What's our posture? What's our foot placement? There's lots of things that work in to help with pelvic floor. It is not a muscle that works in isolation. It's not a vacuum. It's not just one thing that works. It's actually in combination with our whole global strategy of our body. All right, the bit that you've all been waiting for. So we're going to go through some pelvic floor exercises. Now, these exercises, we want to be really mindful. We don't need to perform hundreds of pelvic floor exercises every day. I'll often see women through their pregnancy who have said, yeah, I'm doing my pelvic floor exercises. Every time I'm in the car and I stop at a set of lights, I'm trying to do 10 times 10 reps a day. That's great, but that's actually not how we recommend pelvic floor exercises to be performed now. So we used to recommend fitting them in, at those times, like waiting in the car at the traffic lights, but it's not really appropriate now. So if you imagine, instead of our pelvic floor, thinking of like a bicep, if I was to sit there and do 10 bicep curls in the morning while I brush my teeth, and then 10 bicep curls while I'm in the car, and 10 bicep curls just while I'm waiting for my coffee order, I'm not actually going to get any muscle gains, hypertrophy, or even motor control changes in that bicep. I'm not going to get stronger. If I did 3 sets of 8 to 10 reps of bicep curls all at once, fatigued through that muscle group and learn how to perform that activation, I'm going to get improvements. It's the same with pelvic floor. It's a skeletal muscle. It needs to be trained in sets and reps, not just scattered throughout the day. We also know that pelvic floor is a little bit of a Goldilocks muscle. So too much tension or hypertonicity in pelvic floor can cause dysfunction. Weakness through pelvic floor can cause dysfunction. It likes to kind of be just right. And in particular through pregnancy, we need to be mindful that if vaginal delivery is the goal, that pelvic floor needs to completely relax to allow passage of baby. So we want to make sure that we're teaching both activation of pelvic floor, but also how to relax it back down as well. So our first exercise is just to identify where our pelvic floor is. So if you're sitting listening to this webinar, I want you to try and get yourself nice and comfortable on your chair. So we're going to make sure that we have our legs are out. We're sitting with spreading our sit bones out nice and wide, and we can feel our perineum in contact with the chair. We're going to start by taking a lovely gentle inhale breath, breathing into your tummy, allowing your belly button to just gently blossom out. And as we exhale breath, we're going to exhale through slightly pursed lips. I'm going to go again here. So nice gentle inhale breath, relaxing through the tummy. Inhale. This time as we exhale breath, we're going to think about like we're trying to hold in a fart and stop the flow of urine. As we now relax, so relax again through that breath, we want to feel that pelvic floor relax back down to the ground floor. So it's really helpful to be sitting on something, having your perineum in contact with something for that little bit of extra feedback. Now the only thing that should be moving is just that internal squeeze of pelvic floor. Glutes are not invited to this party, thighs are not working either. I shouldn't see shoulders or jaws clenching to get that pelvic floor activation. Everything else is relaxed. So we're going to try again, really thinking about that internal little squeeze and lift, feeling to see if we can feel that muscle group lift and lower. We want to start at that back passage, so starting at the anus, thinking about that, holding in a fart, or even trying to pick up a blueberry off the chair behind you with your bum. Squeeze and lift, feeling that contraction draw through to the front, like we're stopping or slowing the flow of urine. And this time I'm going to draw up internally that a little bit more. We might even feel a bit of co-contraction through that deep abdominal wall. So we want to imagine trying to suck a milkshake up a straw with your vagina. As we relax back down again, feel for that descent of that muscle group back down, perineum back in contact with the chair. Really mindful not to breath hold through this movement. We're just seeing if we can identify those pelvic floor muscles. We also want to see if we can feel a little bit of that co-contraction through your deep abdominal wall. So if you find your bony hip points, walk your fingers just in slightly, so down to the diagonal, along towards your pubic bone. Just place your fingers gently resting on the top. We're going to take that inhale and exhale breath again. As we exhale breath, we're going to breathe out through slightly pursed lips. Try to breathe quite hard, like you're blowing out a set of candles. And you should feel a little bit gentle tensioning occur underneath your fingers across that deep abdominal wall. So that's our transverse abdominis. That's that team player as part of our core. Now, if you're pregnant and listening to this webinar, you may not feel that same co-contraction. Your bump and the additional the fact that you've got a whole nother person and organ in that abdominal wall and in that pelvic bowl, you may not feel that same co-contraction with under your fingers, but you should feel a little bit of gentle tensioning occur underneath your bump. So we'll go one last time identifying that TA. We're going to take a nice gentle inhale breath, breathing into the tummy, belly button blossoms. And as we exhale breath, we're going to breathe out through slightly pursed lips. Again, feeling that gentle tensioning occur underneath your fingers. So we've identified where our deep abdominal wall is, identified our pelvic floor a little bit. We're going to go through our first exercise. So our first exercise is called quick flips. When we think about how pelvic floor functions, so it plays a role in keeping us continent and playing a role in sexual function. It also needs to be quick to react. So when we cough or we laugh or we sneeze, we need our pelvic floor to be able to react quickly to help hold that the sphincters closed, so it squeezes around our urethra and our anus to help us stay continent as we're walking around and doing our day-to-day. So we want to train it to be able to react to those quick changes in pressure in our abdomen. So we're going to start by taking a lovely gentle inhale breath. As we exhale breath, we're thinking of closing pelvic floor doors and drawing up. As we inhale breath, we relax the pelvic floor back down again. Now, your breathing through this movement is going to be whatever feels most natural, as long as you're not breath holding. So every time I click my fingers, I want you to imagine that zipping up of the pelvic floor. We imagine it like a lift, like an elevator analogy. We want to start with pelvic floor on the ground floor with the doors open. It's not down in the basement, it's just relaxed and the doors are open. As we exhale breath or as I click, we close the doors and we draw it up to level 2. We relax and place it back down to the ground floor, doors open. So we think of drawing up and relax, up and relax. We want to feel that ascent and descent of that muscle group, and we want to make sure that we're still breathing. Good trick to make sure that you're breathing through these is to actually count your reps out loud. So we'll do last 3, 2, and 1, and relax right down. Excellent. How are we all going? So we're going to move on now to our next style of pelvic floor exercises. This time we're thinking a lot more about our core strategy. So we want diaphragm and pelvic floor working together. So we want to be really mindful this time of our breathing. Last time we were just making sure we were breathing. This time the breath and the diaphragm movement is part of the exercise. So sitting up again, lovely and tall, spread those sit bones out nice and wide for your pelvic floor, or your perineum, in contact with the chair. We're taking a lovely gentle inhale breath, breathing into the tummy, belly button relaxes, blossoms out in front, pelvic floor is relaxed on the ground floor. As we exhale breath, we close pelvic floor doors, gently drawing that contraction through to the front, then gently drawing up level 1, level 2, we end up with empty lungs at the top. As we inhale breath again, relax, let that belly button blossom back out and allow that pelvic floor to descend back down to the ground floor. As we exhale breath, closing pelvic floor doors, gently drawing up. Now, as we're breathing and activating pelvic floor at the same time, it can feel a little bit like patting your head and rubbing your tummy. Don't panic if it's starting to feel like you're lost in that movement pattern. It just might require some practice. Inhale breath again, relax pelvic floor, relax the tummy, belly button blossoms out. As we exhale breath, we close pelvic floor doors. Imagine that squeeze around the anus first, holding in that fart. Stop the flow of urine and gently drawing up, empty lungs. One last time. Gentle inhale breath, relax pelvic floor back down, belly button relaxes. And as we exhale breath, we close pelvic floor doors, gently drawing up level 1, level 2. Well done, and relaxing there. Excellent. Now, our last exercise here for pelvic floor is actually to flip the idea of contraction of pelvic floor. So as you can see through those last couple of exercises, our focus was on that drawing up of pelvic floor, so activation of pelvic floor. Now we want to flip the focus and think more about relaxation and descent of pelvic floor. So this is particularly important for pregnancy, making sure what goes up must come down, and for women who have chronic pelvic pain, so endometriosis or pudendal neuralgia, can often have hypertonicity in pelvic floor, so a too tight pelvic floor that doesn't allow us to completely relax, empty our bowels comfortably, have sex comfortably. So we want to make sure that we can relax pelvic floor as well. So for this exercise, we're going to think of some pelvic floor flower blossoms. So we're coming again to that lovely gentle inhale breath, relaxing again through the tummy. Pelvic floor is on the ground floor for us to start. As we exhale breath, we think of that gentle close and lift of pelvic floor. And as we inhale breath, we relax the tummy and we're going to imagine a flower blossoming out of our vagina. As you exhale breath, we close up the petals of the flower and gently draw it back into the bud. Imagine a bud would sit kind of where a tampon would sit. So again, as we inhale breath, we relax through the tummy. We allow our flower to blossom, petals open. As we exhale breath, we close up the petals of the flower and gently draw it back into the bud. One last time here, gentle inhale breath, relax the pelvic floor, allow that flower to blossom full bloom. And as we exhale breath, we close up the petals of the flower and gently draw it back into the bud. Brilliant. So even that imagery, just changing that focus on what you're trying to achieve will make a big difference in how our pelvic floor then functions. So I hope this has been helpful this morning to cover a little bit about our pelvic floor anatomy and some of our pelvic floor exercises that we would recommend here at PEAR. If you do have any other questions or if you would like to get copies of our presentation, please don't hesitate to contact us. So we do have some wonderful telehealth appointments available here at PEAR. Obviously moving with the times of coronavirus. You've got my details there. Feel free to send me an email, jump online. Our practitioners would be very happy to help guide you with some pelvic floor rehabilitation or information, education. As I said, we work with women through pregnancy, new mums. We help guide return to run programs, postpartum, and we also work closely with women with chronic pelvic pain. I will take some questions now and I will stop the recording. So thank you very much for joining me this morning. Take care and we'll speak to you soon.